Hello students, we will discuss a case which is uncommon but quite interesting, but you may come across such cases in surgical OP and what. So what this condition is, look at this, there is a growth, proliferate lesion, see magnified view here, and there is a node also actually, large swelling is there, supraclavicular region, must be a right side supraclavicular lymph node. And you look at the limb, there is a lymph edema is there, right upper limb edema is there. So growth with the right supraclavicular lymph node with the upper limb edema in a male patient, beard is there. In a male patient, so must be carcinoma male breast with the supraclavicular secondaries. Quite advanced malignancy, this one, because supraclavicular lymph node is there. Probably is stuck. If you examine this patient, mobility, axillary lymph node, you see the right upper limb edema, and a male patient you can see here, and it is definitely carcinoma male breast with the neck secondaries. So that is the probable. So what are the features of carcinoma male breast? It is less common. Definitely carcinoma male breast is a non-functioning breast. So it is only 1% common. Infiltrating duct carcinoma is the main type. Lobular carcinoma is not seen in the carcinoma male breast. It is only seen in the female breast. That point you have to remember. It is commonly BRCA2 mutation, not 1. That point also you have to remember. It's very, very aggressive, even though it is rare. Therapy is same like staging, therapy, lymph node involvement, metastatic workup, chest CT, TNM staging. Everything is same as carcinoma female breast. Therapy is same as that, of course. Tamoxifen is useful in carcinoma male breast, even though male breast it is useful. And bilateral orchiectomy is done only in metastatic carcinoma male breast. So details about carcinoma male breast is maybe a short note for you, or oxy they may ask. Such case if comes in the OPD or surgical ward during exam time, may be kept as a oxy, may be kept as a long case also. Short note in the theory may be asked. And as such, it is an interesting entity, even though it is uncommon. Remember, it is very, very aggressive. And gynecomastia, even though specifically not a predisposing factors, gynecomastia can turn into malignancy. There are debate on that. Other things you have to consider, Klinefelter syndrome and so on. And so that is about carcinoma male breast. I am putting a MCQ. Just check which is the most effective drug as prophylaxis in high-risk women for breast cancer. See the question, which is the most effective drug as a prophylaxis? You got options: tamoxifen, raloxifene, doloxifene, oral contraceptive. What is the correct answer in this MCQs? Answer will be told in the next day, tomorrow. So please go check the tomorrow's comment evening. So go through my clinical methods in surgery for examination of the breast with the video showing how to examine, and my SRB surgery in detail about the breast malignancies and breast diseases and all topics covered as per CBME syllabus. And my operative surgery covers all operative surgery technique, skill with illustration and photos. My tissue approximation, how to suture the tissues, and my Diginor lectures. Everything covers for UGs. In detail lectures are there with the operative surgery, specialties, X-ray specimens and so on. So students, hope you understood this lecture very well. Please comment on the MCQ. Thank you very much.